There is a crisis really in the US about incarceration in general. On any single day we have about 2 million people in prison in the US, and of those about 200,000 are women, and that's federal, state and local prisons and jails. There's a turnover in the population each year. That means that maybe 1 million women are incarcerated in the US. The US has an incarceration rate that's almost the highest in the world. So we have a real problem, both in terms of the overall numbers, the rate of increase over the past decade or two. We're just locking up more people for longer. And the cost is enormous. It's estimated to cost about $52 billion a year. And per prisoner, average is $28,000. So most states respond to the enormous cost and how on earth they're going to continue to pay for this in cash-strapped states in the present economy. So it's a crisis, and lots of states are looking at ways in which they can reduce the prison population, reduce recidivism and so on. For women, there are a number of factors that are very special. One is that 85% of them have committed non-violent offenses, that 2/3 have, or 3/4 have children, 2/3 of whom were living with their children at the time they were arrested. And each time a woman is arrested, because she's usually the primary caregiver, her children have to be moved. They're displaced. She may never be convicted. She may be found innocent. But in the meantime, those children have been displaced. She's likely lost her apartment. She may even have lost her eligibility for public housing as a result of being arrested. And the loss of her possessions and the loss of her family life are critical. And everything that happens while she's incarcerated tends to add to that and make it more difficult for her re-entry. And a lot of the re-entry effort is spent undoing all those effects. Regardless of which country you look at or even which state you look at, the actual circumstances and backgrounds of women are very similar. About 85% of the women have committed non-violent offenses, and they're often related to drugs, substance abuse, a sort of self-medication to a lot of the trauma that they have experienced in their lives. So many of them are involved in substance abuse, prostitution. Many of them are depressed and have mental illness, and they often require treatment for what's called co-occurring symptoms and diagnoses. And it isn't enough to treat women first for this problem and then for that problem, because in her life they're all intertwined, and you really need a very holistic, a women-centered model. And we are developing a lot of expertise in knowing much more about what that should look like. So, you know, if you get maybe 1/3 of women committing economic offenses and 1/3 being incarcerated for other offenses, well, that includes driving under the influence and prostitution. And then the other sort of 1/3 is for actual drug-related offenses. So there is this real interconnection of their experience, and of course the treatment is the answer. There is some wonderful research being done on what's called gender-responsive and trauma-informed treatment. And I prefer the term women-centered, by the way, because we are talking about women. And what has happened is that, for example, probation officers and even correctional officers have always told me over a period of many years that they hate to work with women because they're emotional, because they worry about their kids, and because they many of them do have mental illness and substance abuse. They're also either over-medicated or under-medicated while in prison, which adds to their distress. The gender-responsive or women-centered approach really requires understanding almost what post-traumatic stress disorder is like, and the kinds of triggers that set people off. If you're in the forces and serving in the army, it could be a loud noise. For a woman, it could be a situation where she just feels unsafe for whatever reason. It could be a confined space, it could be a male guard, it could be a sense of invasion of privacy. And they react very strongly. And it makes her much harder to deal with in terms of management issues. So there's so much that can be done with responding appropriately. The point is that even when you do trauma-informed courses with correctional officers, the very setting of the prison, with its lack of peer support and peer trust, its notion of encouraging trust and feeling safe, is just not conducive to those dynamics. And in a sense, it would be much easier to do more counseling, day release to programs, and so on. When I completed the report with the data I could collect and the costs that I could manage to obtain, it was very clear that there were a lot of challenges and direct areas that could be addressed. For example, pretrial probation does exist. You can have a woman brought into court and arraigned, and a probation officer is asked to prepare a report on her. She could actually receive probation assistance, referrals to programs and resources that could help her for up to a year without going to court. And then once she goes to court, if she's progressed well, there can be a motion to dismiss. And that's used remarkably little. So we uncovered some of these features, and then we presented them to a forum of policymakers and administrators, including the head of probation or the assistant commissioner, including some legislators, and some line staff who work on a daily basis. And they came up with lots of suggestions. They identified challenges and came up with a lot of suggestions. And as a result of that, the following year, I formed the Mass Women's Justice Network, made up of many of the people who had come to the forum, and spent the last year working with this network. So we are trying to get the language of alternatives and the benefits and the cost factors looked at seriously. So what do we do with all this good networking and discussion and monitoring of some of the recommendations that we made the previous year? Well, it's very timely, but the governor of Massachusetts has created a criminal justice commission to really overhaul and look at the entire system because of the scandals that broke in probation and parole. And those meetings are open to the public, and a number of our network members are on the commission and on the various subcommittees. And we've invited them to work with us, and we've gone to meet them. And what I've done is put together 6 fact sheets, back-to-back, very easy to read, summaries of key issues that we've identified and worked together as a network. And those will be distributed to the Commission this fall. We have set ourselves a goal of being the women's voice on the Commission and to the Commission. I would say that the methodology that I employ predominantly is the case study methodology. My aim is to explore in depth a particular issue, and then, even though it's not generalizable in any statistical and scientific sense, it raises some really important questions that you might, based on in-depth knowledge that you might not otherwise gain. It involves very much the people involved in the system, whether they be the offenders or the people who work with them, also the legislators who are concerned with these issues. So it's very participatory, it's in-depth, it's exploratory, and it's iterative. Each new set of questions is based on the previous study and what it showed. So when I started with looking at the issues of women in prison, I looked at women and their family connections. I tried to count how many women do we have in prison over a year, how many families are affected, and that had never been done before. I went to various other departments, not just corrections, to see the ways in which they might work, say with the children of women in prison, or some of the housing issues when women come out again, or even welfare issues. And that led me then to look at what kinds of programs are really effective for women. And one of my prison studies had shown that there were a couple of community-based programs that had entered the women's prison, that were there on a regular basis, that had even created some system change by changing some of the rules, of which there are many in any prison. And so I went to look at these community-based programs that seemed to work so effectively with women. And that study was called Exploring Gender-Responsive Community-Based Programs for Women. And I worked with a large coalition of experts across the state, and they recommended various sites and programs across the state to do site visits. And we learned a lot about how extraordinary programs exist to treat women, to come into the prisons and jails and counties and work with the women, and then provide continuing services when they leave. And that was a real eye-opener, even in these times of stringent fiscal constraints and so on. And then I noticed that some of those programs actually worked with women pre-arrest or on probation. And that was the question that led me to what kind of work is being done on alternatives to incarceration.